Alzheimer's disease is a devastating condition that affects millions of people each year. While current treatments provide some relief, they are limited in their effectiveness. Leqembi, containing Lecanemab, is a new drug that holds great promise for those suffering from Alzheimer's. Introduction to Alzheimer's disease. Impact. Alzheimer's is the most common cause of dementia, affecting memory, thinking, and behavior. Prevalence. 5.8 million Americans aged 65 plus suffer from Alzheimer's, and this number is projected to triple by 2050. Cause. Alzheimer's is caused by a buildup of beta-amyloid protein in the brain, leading to neural damage and degeneration. Symptoms. Symptoms include memory loss, confusion, personality changes, and difficulty with day-to-day tasks. Note: this video is intended for informational purposes only and should not replace professional medical advice. Always consult a healthcare provider for personalized guidance. Current treatments and their limitations. Cholinesterase inhibitors. These drugs increase the level of acetylcholine in the brain, helping to improve memory and cognitive function. However, they only provide modest benefits and can cause annoying side effects. Memantine. This drug regulates glutamate, a chemical messenger in the brain. It can help with symptoms such as confusion and agitation, but does not slow the progression of the disease. Limitations. Current treatments are unable to stop or reverse the damage caused by Alzheimer's, and their benefits are limited to certain symptoms and stages of the disease. Leqembi. Lecanemab. Overview. Leqembi is an antibody that targets beta-amyloid proteins in the brain, promoting their clearance and reducing the buildup. Mechanism of action. By binding to beta-amyloid proteins, Leqembi prevents their aggregation and promotes their breakdown by immune cells, limiting neural damage. Composition. Leqembi is a human antibody produced by genetically engineered mice that have human antibody genes inserted in their genomes. Indication of Leqembi. Leqembi is FDA approved for treating mild cognitive impairment or mild dementia due to Alzheimer's disease. Its safety and effectiveness have only been studied in this population. Dosage and administration. Available as 500 mg per 5 ml and 200 mg per 2 ml solution in a single dose vial. Dosage 10 mg per kilogram administered intravenously once every 2 weeks to eligible patients with confirmed presence of amyloid beta pathology prior to initiating treatment. Enhanced clinical vigilance for amyloid-related imaging abnormalities is recommended during the first 14 weeks of treatment. Monitoring with MRI. Baseline. Recent, within 1 year, brain MRI prior to initiating treatment with Leqembi, and periodic monitoring with MRI prior to the 5th, 7th, and 14th infusions should be obtained. Clinical trials. Results and effectiveness. Leqembi was evaluated in a double-blind, placebo-controlled study of 856 patients with confirmed amyloid beta pathology. Patients receiving the approved dose had a statistically significant reduction in brain amyloid plaque from baseline to week 79 compared to the placebo arm. Side effects. Reported common side effects of Leqembi in clinical trials included infusion-related reactions, headache, and amyloid related imaging abnormalities, edema. Less common side effects include cough, diarrhea, atrial fibrillation, and lymphopenia or decreased lymphocyte. Amyloid-related imaging abnormalities. Leqembi can cause amyloid-related imaging abnormalities, which are usually asymptomatic but can rarely be serious and life-threatening. Symptoms may include headache, confusion, visual changes, dizziness, nausea, gait difficulty, and neurologic deficits. ARIA symptoms usually resolve over time. Infusion-related reactions. Leqembi can cause infusion-related reactions. Symptoms include fever, flu-like symptoms, nausea, vomiting, hypotension, hypertension, and oxygen desaturation. The infusion rate may be reduced or discontinued, and therapy initiated as needed. Prophylactic treatment with antihistamines, acetaminophen, nonsteroidal anti-inflammatory drugs, or corticosteroids may be considered. Challenges associated with Leqembi. Cost. Leqembi is likely to be expensive, making it inaccessible to some patients. Administration. The drug needs to be administered intravenously, which can be challenging for some patients. Safety profile. Long-term safety of Leqembi is still unknown. I hope information provided in this video presentation was helpful. Please like, share and subscribe. Thank you for watching.